South Africa is in the throes of a third wave of the coronavirus, and 3 variants are at the forefront of the latest surge in coronavirus infections. Joining us now to explain the extent of the crisis is senior Bhekisisa Health reporter Aisha Abdool Karim. Aisha, very good afternoon. Thank you for speaking to us. Take us through these variants of concern.
So I think the first thing is just to help distinguish between a variant and a variant of concern. So there are lots of variants of the virus because over time the virus just tends to develop changes, and most of the time these changes are sort of insignificant. They don't really mean anything. So the designation by the World Health Organization is if something becomes a variant of concern, it means that it's developed a mutation which is allowing this specific version of the virus to do things that would either allow it to spread more efficiently or to perhaps evade immunity, or it would render things like vaccines or testing tools less effective. So that's just how we distinguish between what is sort of an okay version of the virus that had some changes that are already affected, and a variant of concern is where the changes are something that are changing how the virus behaves within society. So currently there are 3 variants of concern circulating in South Africa. The first, which is the most dominant, is the Beta variant, which was first identified here last year. The second is the Alpha variant, which was first identified in the United Kingdom. And the third most recent variant to be identified is called the Delta variant, and that was first identified in India.
Now, do we have capacity to deal with the mutation of these variants? I mean, let alone trying to cope with the spread of COVID across the country?
Yeah, so essentially why it's important to understand the variants and know which ones are circulating is because we need to be able to incorporate these variants into our COVID-19 response, which is something that we saw during South Africa's second wave, which happened over the November, December, January period, where we saw that despite the preparations that had been made during the first wave, everyone was sort of caught off guard by the more severe second wave. And what we learned during that period is that the rapid rise in cases and the increased severity of the wave was due to the identification of this new variant called the Beta variant. And so that's why we're keeping a very close eye on other variants that are being detected in the country, because even though it's still only a very small number of these other 2 variants that have been identified, we need to know which variants are present and what these variants mean for the outbreak, because as we see variants, they can change what the epidemic looks like, and so our response needs to account for that. So for example, the Delta variant caused a very severe wave in India, so that's why it's a variant to keep an eye on and see what it could mean for South Africa's outbreak if we start to see a rise in cases, which luckily has not occurred yet. But that all of these variants are doing different things and they're functioning differently. So the Beta variant is able to evade some kinds of immunity. It's able to spread more efficiently. The UK variant is able to spread more efficiently, but it doesn't have that same immunity component that the other 2 do. So we need to be able to factor in all of these different changes and what they could mean for what we're going to see as the cases do go up during the third wave.
Aisha, please explain to me. You've said that you are monitoring how these variants work. Is this monitoring occurring in a laboratory, or are you physically monitoring the spread of the virus amongst the citizens of South Africa?
Yeah, so there are several different components to monitoring what a variant is causing. So the one component is firstly the genomic sequencing. So that's done by several teams across the country that are part of a consortium that all work on this, where they take samples of the virus and they basically they unravel the genetic code of the virus to understand what mutations have taken place. And then the next stage is to understand the significance of those mutations and what they're actually allowing the virus to do. So, for example, there are labs in South Africa which are testing, for example, what the mutations might mean for immunity. So in a lab, they then take the virus and they take antibodies, which is something that your body produces to fight off viruses, and they see how well the antibodies can fight off this particular variant. And that's sort of how we were able to, at the beginning of the year, see with the beta variant, they were able to do these laboratory tests to see that the antibodies were less effective at fighting off this particular variant. It is important to know, though, that the lab tests are not definitive. So these laboratory tests can give us an indication of what we could see, but ultimately they're not the same as what's actually happening in your body, because the immune system is really complex. It's not just antibodies. There's a lot of components that go into protecting you, that go into fighting off these kinds of viruses. And so that's where you need to take into account that you might see some differences in real life as opposed to just what the lab tests are telling you. And then in the terms of these particular variants that we're seeing, so for the beta variant, we were able to observe what happened during our wave. And for the alpha variant, there is information, and also for the delta variant, there's information from other countries where those variants have become dominant. For example, in the United Kingdom, there is data showing what they've experienced in their country with people that have been infected with the variant. So it's a combination of laboratory testing and then also seeing what's happened to people that are getting infected with these new versions of the virus, and what that means for how vaccines are working, and what that means for how the disease progresses, if it's any different to the original version of the virus.
Immunity is clearly a part of the conversation when we discuss COVID-19. Is it possible for one to enhance their own immunity?
So, I mean, you can't enhance your immunity in the sense that you can't really improve how you're responding to something, but the one way that you can protect yourself is through vaccination. And so the idea with being vaccinated is that you get exposed to a safe version of the virus. It's harmless and it's not actually going to infect you, but it sort of exposes your body to a particular part of the virus to help train your immune system as to recognize this thing as an invader that needs to be fought off, and something that you need to be able to protect yourself from. And the idea is that by exposing your body in the safe way, if you do eventually get exposed to the real virus, later on down the line, your body already knows how to fight it off and has these antibodies and T cells, and that immune response is pre-existing. And so in that way, you have a better chance of fighting off the virus, because if you're leaving it up to your body can fight off the virus eventually, but it will be sort of playing catch up to the virus. So the virus will infect you, you'll get sick, and there could potentially be some damage done, which is what we've seen with some cases of COVID, where it can damage your lungs. And so even though you're able to naturally fight off the infection, that damage has been done already to your body. And so with the vaccine, when you go in with this level of protection already, you can prevent the harm that is caused by infection. And in that way, you're able to protect yourself, and you're not trying to retroactively stop the virus, because you'll go in already protected to some degree.
Finally, Aisha, before you go, we entered the third wave a week ago. How long can we expect this wave to last?
So that's a difficult question to answer. As we've seen, it's very hard to predict how things are going to progress with this virus. COVID is an unpredictable disease. The waves can vary in how long they last. We tend to expect them to last between a month to a month and a half. but it's really difficult to make that kind of projection. And we also can't predict how severe a wave is going to be because it all depends on different factors at play, such as how many preventative measures people are taking. It does, to some extent, depend on which variants are circulating. Eventually, it will also depend on how many people are vaccinated. So there's a lot of things that could change how long a wave lasts for and how severe that wave is. So it's too early on into the third wave to really predict what it's going to look like at this time.
Senior Bhekisisa Health reporter Aisha Abdool Karim, thanks for your time this afternoon.